As the new administrator of a primary medical clinic, it is my role to make sure the clinic is ran in a manner according to policies and procedures. It has been brought to my attention that there is a list of issues that need to be handled to ensure the safety and happiness of our workers. The happier our staff is, the better work they will do. 10 of my physicians address the following.
Problem 1. The clinic is a high crime area. Several employees are getting mugged on their way to work. I said solutions. A short-term one would be to light the parking lot, entryways, and have security guards to monitor it. Another solution, more long-term, would be a designated area for physicians and employees to park, and the area could have key cards and a passcode for entry. Problem 2. Theft inside the clinic is rampant. Purses, medicines, and supplies continue to disappear. I said solutions would be that all personal belongings should be stored in a separate room, and employees will have combination locks instead of locks and keys. But furthermore, I said that all the areas should be monitored by cameras, medicines should be locked, and all of the medications should be counted each shift change. And this would kind of, show which shift might be causing the problems. Problem 3. Last year, a patient nearly died in the waiting room because she had to wait so long to be seen. I said that the solutions to this need to be based on levels. Hospitals usually have a method to determine if a patient needs to be seen immediately or if they can wait. Elaborating further on these priority levels, level 1 would be immediate or life-threatening problems, level 2 would be severe, potentially life-threatening problems, and level 3 would be pain or difficulties such as a broken bone, but they can wait. Problem 4, information of patient files is being misplaced, and this leads to lost time in diagnosing and treating patients. I said a short-term solution is to appoint staff to sort and reorganize files. However, in the long term, we want to transition to an EMR so data is easily accessible for all staff, and this will improve productivity in the area. Problem 5, the woman at the registration desk takes unscheduled 2-hour lunches, which slows down everything. One, you never want this to happen because it makes everyone else think it's fun to do that. So I said, let's do a mandatory staff meeting, clinic-wide to remind everyone of their max break times and lunch times. But they also need to enforce a policy that anyone who is more than 10 minutes late, unless there was like a traffic jam or something crazy, an accident, that you will be reprimanded. This is important. You need to work your hours that you're supposed to, and everyone around you depends on you being there on time.
Problem 6. We understand the building is old, but it does not have to be dirty. The janitor is absent most days, and when he's here, he won't clean. He sits in the parking lot and smokes. My solutions for this problem would be an immediate meeting with the janitor to state the standards expected of his cleaning. His breaks will also be limited to 10 minutes twice a day, plus a 1-hour lunch break. If he cannot meet these standards within the week and continue meeting the standards, he will be replaced. Problem 7. We never know who to go to for assistance with clerical work. The nurses say it is not their job, and the registration clerk laughs if we ask her for assistance. We can't take care of ordering supplies and scheduling vacations and take care of patients. My solutions for this problem are an immediate hiring of an office manager to handle the ordering of supplies and scheduling. The office manager will be allowed to reprimand disrespectful nurses and registration clerks. A staff-wide email reminding everyone that this is a team and we all have to work together will be sent out. Sometimes team members will have to step up and help in an area that is not their exact job. Problem 8. Our patient records are so disordered that if we need to find someone in a hurry with an abnormal test result, we can't find their chart. My solution for this problem is that the office manager and I will work closely to choose and enact an EMR system immediately. Problem 9. The exam rooms must be cleaned between patients. Doctors shouldn't do this, nurses won't do this, and the janitor is out back smoking. Whose job is it? My solution and answer to this question is the janitor will clean all rooms at the end of the day, and nurses will be in charge of the light cleaning between patients. If there is a patient that has left a mess so large in the room that it will keep the nurse from other patients for more than 5 minutes, the janitor will be paid to clean the room. Problem 10. Parking costs employees $15 per day, and that's at a cheap lot. You have to do something about the cost of parking. My solution to this problem would be all staff will receive parking vouchers for scheduled shifts at a designated lot. If for some reason there is not a spot that has been prepaid for, the office will reimburse the staff member with the presence of a receipt.
Our first cost is based around our first problem area of need for increased security. To do this, we will hire a new security guard at a cost of around $1,000. This cost is based around the amount of money that is required to pay a human resource employee during the search and the amount of money needed to advertise the job itself. In order to increase security of various storage issues, we will buy a cabinet made specifically for medications that includes a coded keypad. We will also buy a set of lockers for employee use. This will come at an approximate cost of $849 based on current prices of those two pieces of storage. To serve the needs of our two problem areas of patient wait times and disorder with paper charting, we will implement a new electronic medical record system. This system will cost approximately $16,054 for initial obtainment and fees associated with running and maintaining the system. As a clinic, several problems include employees who are not currently doing their jobs or a scenario in which an employee would greatly fix the problem altogether. The janitor is not doing his job to the extent to which he was hired for. If a replacement is needed, the cost to hire a new employee will be incurred. A new hire for an office manager is needed to handle any general clerical needs of the clinic. These hires will result in a cost of $1,000 for the time of the human resource employee and the cost of the job listings. Employees are currently paying out of pocket for parking in the surrounding area of the clinic. To solve this problem, the clinic will pay for daily parking of employees in the already constructed lots near the clinic. This will be at a cost of approximately $3,750 per employee per year. This number is based upon the $15 of the cheapest lot being paid for 250 days, or a year minus all federal holidays and weekends. With the new hire of a security guard, security for both patients, employees, and the clinic building will be added. Employee satisfaction will also increase because they will have someone to walk with them to their car, so they are no longer getting mugged. New secure storage for medication and employee possessions means that medication and other items will be accounted for at all times. This will also help with clinic organization because all inventory of medications will be available and providers will no longer be unsure of the amount of medications the clinic has. Through the use of the new EMR system, an increase in productivity for staff and an increase in clinic organization should occur. Overall patient satisfaction will also increase because wait time and disorganization of the office will be cut down. If a replacement hire for the janitor is needed, the benefits will be increased cleanliness of the building. A new office manager will increase the organization and productivity of the clinic office. By paying for employee parking, the clinic will see an improvement in employee satisfaction. Although nominally the cost of fixing the problem areas addressed by the employees seems large at $22,653 in total, the benefits far outweigh it. The clinic should expect to see an increase in productivity, an increase in security, and an increase in patient and employee satisfaction. Through these improvements of the facility, an increase in patients should also be expected because of the new satisfaction and productivity.
In conclusion, each of the concerns brought to my attention were preventing our staff from being able to properly run our clinic. Safety, time management, wait times, proper filing, monitored breaks, cleanliness, parking cost, and teamwork are all necessary to operate a clinic. The solutions we've came up with will improve the work ability and overall happiness of our staff.